Welcome everyone to a deep dive into a rare and often underdiagnosed vascular condition, segmental arterial mediolysis, or SAM. This complex disorder can affect arteries throughout the body, leading to serious complications. We're going to explore what SAM is, what causes it, how it's diagnosed and treated, and what the future holds for those affected by this condition. So, let's get started. The exact cause of SAM remains elusive, making it a bit of a medical mystery. What we do know is that it's non-atherosclerotic and non-inflammatory in nature. Researchers currently believe that the primary issue lies within the vasa vasorum. These are the tiny blood vessels that supply blood to the walls of larger arteries. It's hypothesized that abnormalities or spasms within these vasa vasorum lead to ischemia, or a lack of blood flow. In the medial layer, that's the middle layer of the arterial wall. This ischemia then triggers the mediolysis, or destruction, that characterizes SAM. Factors like high blood pressure, certain medications, and even pregnancy have been suggested as potential triggers or contributors, but more research is definitely needed to confirm these associations. Now, let's delve into the pathophysiology of SAM. The damage starts with the mediolysis, or the breakdown of the smooth muscle cells in the medial layer of the arterial wall. This weakening of the arterial wall can then lead to a cascade of events. These include aneurysms, which are balloon-like bulges in the artery wall, dissections, where the layers of the artery wall separate, and even ruptures, which are potentially life-threatening tears in the artery. When these events occur, they can cause significant bleeding, block blood flow to vital organs, and ultimately lead to serious complications. The location and extent of the arterial damage determines the specific clinical manifestations. SAM is considered a rare condition, and its true prevalence is difficult to estimate. Because its symptoms can mimic other more common vascular diseases, it's likely underdiagnosed. It affects adults of all ages, although some studies suggest it might be more prevalent in middle-aged individuals. There does not appear to be a significant difference in incidence between men and women. Due to the lack of definitive data, epidemiological studies are ongoing to improve our understanding of this condition's occurrence. The signs and symptoms of SAM can vary greatly depending on which arteries are affected. Many individuals initially experience no symptoms at all, and the condition is only discovered incidentally during imaging for other reasons. However, when symptoms do occur, they can be quite dramatic. Abdominal pain is a common complaint when the visceral arteries are involved. Headache, stroke-like symptoms, or even sudden death can occur when cerebral arteries are affected. Flank pain and hypertension can result from renal artery involvement. In some cases, individuals may experience symptoms related to ischemia in the affected organs, such as intestinal ischemia, which can cause severe abdominal pain and bloody stools. The variability in symptoms makes diagnosis challenging. Diagnosing SAM requires a high degree of clinical suspicion and careful evaluation. Imaging techniques play a crucial role. CT angiography, or CTA, and magnetic resonance angiography, or MRA, are typically the first-line imaging modalities. These scans can reveal aneurysms, dissections, and other abnormalities in the arteries. Digital subtraction angiography, or DSA, which involves injecting contrast dye directly into the arteries, can provide even more detailed images and may be used in certain cases. It's important to remember that SAM is a diagnosis of exclusion, meaning that other conditions such as atherosclerosis, vasculitis, and fibromuscular dysplasia need to be ruled out first. Biopsy of the affected artery is usually not performed due to the risk of complications. While not strictly classified into distinct types, SAM can be categorized based on the location of the affected arteries. Visceral SAM, involving arteries supplying the abdominal organs, is the most common form. Cerebral SAM affects the arteries of the brain, while renal SAM involves the arteries of the kidneys. Each location presents with its unique set of clinical manifestations and potential complications, guiding diagnostic and treatment approaches. Treatment for SAM focuses on managing the acute complications and preventing further arterial damage. In some cases, particularly when the condition is discovered incidentally and the aneurysms are small and stable, conservative management with close monitoring may be sufficient. However, more aggressive interventions are often needed. Endovascular procedures, such as coiling or stenting, can be used to treat aneurysms and dissections. In some cases, open surgical repair may be necessary, especially when endovascular options are not feasible. Medications, such as blood pressure control agents and antiplatelet drugs, may also be used to manage symptoms and prevent further complications. The specific treatment approach is tailored to the individual patient and the severity of their condition. Unfortunately, there are currently no known preventative measures for SAM. Given that the exact cause is still unknown, it is difficult to formulate definitive preventative strategies. Maintaining overall cardiovascular health managing blood pressure, and avoiding potential triggers such as certain medications may be beneficial, but more research is needed to confirm this. The prognosis for individuals with SAM can vary widely, depending on the extent and location of the arterial damage, as well as the promptness and effectiveness of treatment. Some individuals may experience a complete recovery with minimal long-term complications, while others may face significant morbidity or even mortality. Recent research is focusing on identifying potential biomarkers that can help predict the course of the disease and guide treatment decisions. Additionally, advancements in endovascular techniques are offering less invasive treatment options and improving outcomes for some patients. Continued research is crucial to improving our understanding of SAM and developing more effective strategies for diagnosis, treatment, and ultimately, prevention. We hope this overview has been helpful in understanding this complex disease.